lecturer from SNS College of Allied Health Science from the Department of Operation Theatre and Anesthesia Technology. In the previous class, we have seen about we have started with the anatomy of skin. So in this previous session, we have seen about the introduction and then the types of skin, namely hirsute, which is called as thin hairy skin, and the thick hairless skin is known as glabrous skin. And also we have seen about the layers of skin, and in which we have seen in detail about epidermal layer. So in that we have also included about the cell types that are usually present in the epidermal layer, and the 5 layers, namely from superficial to deep, namely stratum corneum, stratum lucidum, stratum granulosum, stratum pinosum, as well as stratum basilae. In this class we will be continuing with the skin dermis layer. So it is usually the middle layer of the skin. It is composed of dense connective tissue. Thickness is about 0.3 to 4 mm. The components of dermal layer includes fibroblast, which produce collagen, and elastin, and also ground substance. This collagen provides strength, as well as the elastic fibers provides elasticity to the skin. And then this dermal layer consists of 2 layers. Papillary layer, another one is reticular layer. This papillary layer is usually a thin superficial layer. It consists of loose connective tissue and also dermal papillae, which interlocks with the epidermis, and meschneier's corpuscles. The reticular layer is a thick layer that consists of dense connective tissue, collagen, and Paschen follicles. These meschneier's corpuscles are usually known as the nerve endings, which is used to sense the high frequency radiations or vibrations, while the Paschen follicles corpuscles usually senses the low frequency vibrations. And then skipping to the hypodermis, it is the most deepermost layer and not technically part of skin but closely associated. It is composed of the loose connective tissue and adipose tissue. The thickness varies, thick in abdomen as well as thinner in the scalp. The components are adipose tissue, blood vessels and nerves, connective tissue. These adipose tissue stores energy, while the connective tissue anchors skin to the underlying structures like muscle as well as bone. And next we are just going to see about the skin appendages. So these skin appendages are specialized structures that develop from the epidermis and are embedded within the dermis of the skin. So the most commonly present skin appendages are hair follicles, nails, sebaceous gland as well as sweat glands. These hair follicles, these are the structures that produce hair and are associated with sebaceous gland and arrector pili muscle. So nails, these are usually the hard plates of keratin that protects the fingertips as well as toes. Sebaceous gland, these glands secrete sebum, oily substance that lubricates and protects the skin and hair. Next, about the sweat glands, these are the glands that secrete the sweat. There are mainly 2 types of sweat glands, eccrine gland as well as apocrine gland. These eccrine glands are widely distributed all over the body, and they secrete a watery sweat that helps to regulate the body temperature through evaporation. While the apocrine gland, these are the larger gland which are open into the hair follicles rather than directly onto the skin surface. They are mainly found in armpits, groin region. They are also associated with the body odor. Next, the skin's blood supply, venous drainage as well as nerve supply. So basically the skin is supplied by the 2 main arteries, direct cutaneous artery as well as musculocutaneous artery. This direct cutaneous artery supplies mainly skin directly, and musculocutaneous artery supplies skin and underlying muscles. The venous drainage is done by superficial vein as well as deep vein. Superficial vein drains from the skin and subcutaneous tissue, while the deep vein drains from the muscle and deep tissues. And also we have seen about the nerve supply, sensory nerve fibers which transmit sensations such as touch, temperature and pain. Autonomic nerve fibers regulate sweat glands functions, blood vessel tone like vasoconstriction as well as vasodilation. In the next class, we will be continuing with the functions of skin as well as we will be seeing the assessment based on the anatomy of skin. Thank you. Thank you.